Namaste, my dear brothers and sisters. I have with me here today Dr. Surinder Katoch and Dr. Mukta Katoch, two brilliant Ayurvedic physicians, a mother and daughter team. One actually young, the other young at heart. This evening we shall discuss a very common disease which may not be responsible for much mortality, but is one of the most disabling diseases, and therefore the morbidity that it causes is really enormous. The disability that it produces is something that we are all familiar with because we all know somebody or the other having osteoarthritis, the problem with joints, which most commonly affects the knees and the hips, which occurs in old age and is essentially because of the degeneration of the cartilage. Uh, it's sometimes called a wear and tear disease, but then the body has very good healing mechanisms, and that is something which wear and tear does not uh, make us realize. We feel that it's an inevitable part of aging. Since something is being used for a long time, it will undergo this wear and tear, and this is inevitable. But in fact, what is happening is wear and tear is a continuous process, but at the same time, repair is also a continuous process. So the disease is the result of not just wear and tear, but an imbalance between wear and tear on one hand and repair on the other. And when the wear and tear exceeds the becomes the dominant thing, then the person starts getting symptoms. But the hope that it gives is that if we are able to stimulate the repair, then we can once again turn the balance the other way around. So that is something specially which Ayurveda looks at, and these two Ayurvedic physicians will now give us the experts' voice on this problem. So let's start with the first question. Uh, in Ayurveda, we don't look upon osteoarthritis so much as a wear and tear disease, but as a disease of vata excess, isn't it? Now, vata is light and mobile, and one of the contradictions that strikes a person is that the dominance of a dosha, which is light and mobile, actually makes the person heavy and immobile. So, would you like to comment on this contradiction to start with?
Yes, sure, sir. First, it's a pleasure for me to be in this program with you. So, thank you so much. And, sir, as you said, that this disease is of Vata, and there is a contradiction that Vata is light and mobile, whereas a person suffering from osteoarthritis becomes heavy and immobile. So, but as you rightly said, that this is a disease of degeneration, and aging is a natural process. And when we talk about the places of Vata, Pitta, Kapha in the whole body, which is the area where Vata is more, where Pitta is more, and where Kapha is more. So when we talk about osteoarthritis, then that means it has something to do with the joint. And joint is the place of Kapha. Uraha, Shiro, Griva, Parvani, Amashyashta. So Parv is joint. And joint is the place of Kapha. And osteoarthritic conditions, if we see anatomically and physiologically, there is synovial fluid, and that is, we also call as, it is a place of kapha. So with age, there becomes depletion of kapha, and relatively vata increases. Body में जब भी क्षय होगा वाता बढ़ेगी. So therefore, the kapha decreases. It can decrease with age because aging sahaj rog hai. Sahaj rog is called the diseases which are of the elderly age. But yes, Ayurveda talks a lot about increasing and delaying the aging process, where we have number of things in Ayurveda where we can delay the aging process so that the problems which is osteoarthritis gives us, if it gives us after the age of 80 or 90, then it is okay. But if it is giving us in the age of 30s, 40s, 20s, then it is a problem. So therefore, it is depletion of kapha, relatively increase of vata. So this statement that It is a disease of Vata, and Vata is mobile and light, but the patient suffers from the other symptoms. This does not coincide because it is a disease of basically the area of Kapha, and Kapha is heavy in nature, and Kapha usually is Pangu, sedentary, it's immobile. So therefore, in this aging process, there is a combination of Kapha and Vata. So the heaviness, immobility, the whole, both Vata and Kapha, both of them contribute. And this osteoarthritis can be, because whenever we say that it is a degenerating condition, degeneration can also be because of overuse. So if it is overuse, it can also be because of underuse. Therefore, we definitely have to see the underlying cause. That why this is happening, the people who do labor work, mazduri, so they have to handle number of things on their hands, weight like this. So their degeneration is of the shoulder joint. And the people who are athletes and running a lot, their degeneration can be of knees. Their degeneration can be of the lumbosacral spine. So therefore, it depends upon the causes also, and we take number of things into account. So Vata alone is not responsible for osteoarthritic conditions.
So while I mean it is a disease of Vata excess, the organ itself, the part of the body itself is Kapha. And
Yes.
apart from this doshic imbalance, it
Yeah.
is also in the overuse, abuse, or underuse of the
Yes,
joints,
correct.
which can
And
give rise.
similarly,
Yes.
in osteoarthritic conditions, we have all the three types of symptoms.
Mm.
The pain because of Vata. There can be burning sensation in the infected joint, Pitta. There can be swelling in that affected joint, Kapha. So therefore, ultimately, when we see, it becomes a Tridosha Jiro, all the three together. That's it.
Also, in addition to this, I think so. There is a concept of dosha and dhatu. So each of the doshas, they have we have 7 dhatus in the body and another 7 upadhatus and various parts of the body. So each dosha is predominant in a specific dhatu, in a specific updhatu. So vata that ways is a little tricky. So when we see the sthan of kapha and pitta, whenever kapha and pitta will increase, the respective dhatu and the upadhatu will also increase. But vata is inversely proportional to its dhatu and updhatu. Whenever the vata dosha will increase, the respective dhatu and upadhatu will undergo kshaya. It will start depleting. So the sthan of vata in the body is asthi, the bones in the body and the joints of the body, which are formed by the bones again. So whenever vata will increase, so we are saying that the chala guna, mobility of the vata, lightness of the vata will increase, but it will have an opposite effect in the case of this disease because it is going to cause stiffness, it is going to cause restricted movement and heaviness because of the restricted movement.
Thank you, Mukta. Now, since it's a tridoshic disease, that makes it a little more complex, and we have doshic dominance also during different seasons. So, how does it interact with the seasons? Which are the seasons in which one finds an aggravation of the disease?
See, definitely one of the major symptoms in osteoarthritic condition is pain. So when we consider pain, so the season which we say, the season of Vata is Varsha Ritu, the rainy season. And then comes the winter, where it is cold also, it is dry also. Both the things are there. So these two seasons basically are the seasons where this disease, the symptoms, they get aggravated. The rainy seasons, pre-winters and winters.
So that's why probably the worst combination is rainy season or high humidity. And along with that, if the person makes the mistake of sleeping in an air-conditioned room, uh,
That is worse, yes,
the worst
definitely.
combination.
Yes,
Mhm.
true. Because cold is also the quality of both. Cold is the quality of both, Vata as well as Kapha, both. Therefore, the symptoms, they become worse.
Now, foods also have an effect of aggravating or pacifying a particular dosha. So, which are the foods that a person with osteoarthritis should avoid, and which are the foods the person should emphasize?
Yes, definitely food has a very big role in it. And like when I see patients, I see majority of the patients doing the same mistake, and they do the same mistake because this is the knowledge which is prevailing in the society. This is the knowledge being given by doctors also, whether they are homeopathic, Ayurvedic, allopathic, any doctors, but their type of advice given on dietetics is almost the same. But when we talk about Ayurveda, we definitely should go ahead with the authentic knowledge. Authentic knowledge says it is a combination, suppose, of Vata and Kapha. So what the people have started doing is that they have stopped the intake of oily foods, ghee, and they have increased the intake of cold items and dry items. So like leafy vegetables, lot of salad, cold coffee has become very common, iced tea, that has also become very common. Then people have started different types of seeds. So these types of foods, and secondly, the lot of emphasis now is being given on proteins. On the name of proteins, the non-vegetarians, they basically have pulses also, they have soya also, they have non-veg also, they have eggs also. And every day they are consuming, so the quantity is becoming too much. And when we talk about pitta, pitta is responsible for degeneration also. And if it is pitta, then so much of non-veg should not be consumed. So much of protein should not be consumed. But the knowledge which is prevailing is the people are bent upon and they keep on having all this, lot of soya. Even in milk, they have soya milk, they have almond milk. This has become very, very common nowadays. So all these actually, lot of salad, lot of fruits, lot of leafy vegetables, then having no oil in food, oil-free food, these are aggravating factors rather. They increase the pain in osteoarthritic conditions because what is happening is in between the joint, the kapha is decreasing. And because of that, relatively vata is increasing and a person is having pain. Therefore, we should have certain food items which actually increases kapha. Therefore, we say that you should have oil. Don't go ahead for completely oil-free food. You should have ghee in your food. You should add butter in your food, which is white butter. But then when we talk about sweets, people again have totally stopped them. No need of stopping them. Natural sweetness, because if we see the old people, they were very fond of these figs, anjeer. So almond also has oil directly in dry fruits. When we talk about dry fruits, even when the people come who consume dry fruits, they consume a large quantity. That again becomes a problem. So therefore, dry fruits, one or the other dry fruit, either akhrot or badam, along with that, one or two, the sweet dry fruit. Like if the size is big, figs are big in size, khajur is big in size. So the size which is big, which we can have two pieces. The size which is smaller, like munakka, because people in this condition usually have constipation also. So munakka works for constipation also. Munakka is smaller than figs. So therefore we can have 5 pieces of munakka. Raisins are further smaller than munakka also. So we can have 10 pieces of raisins. So this way we need to choose judiciously. So therefore all the things which are dry in nature, a simple formula, all the things which are dry in nature, they should be comparatively avoided. And unctuousness, oily, and ghee should be added, but in optimum quantity. Not that added means that you end up into huge quantity. So this should be a lot of fruits. 1 fruit a day is enough. So people have a good platter of fruit, good platter of salad. That sometimes doesn't work. Then the next food item is curd. So curd blocks the channels of the body and creates heaviness in the body. There is already heaviness, so the heaviness should not be increased. So therefore, usually people consume curd, and as an Ayurvedist, we always say in osteoarthritic conditions, we should not consume curd on a daily basis. This is what it is.
Dr. When
I
you were
think
speaking, I was thinking of a what Sir Stanley Davidson, who was a physician and also with specialization in nutrition. He said that all fat diets are bad diets, and fads keep coming and going in the field of dietetics. And for the last few decades, the fad has been the less oil, the better, and the more of green leafy vegetables, the better. But then we forget that this is again universal wisdom that excess of everything is bad, or as we say in Sanskrit, ati sarvatra varjayet. So that we forget.
Yes.
Mukta, would you like to add something to what?
yes. So I wanted to say something, but I will continue from where you've left, sir. So the concept that is coming that we should go all green. But recently there was a famous nutritionist who was in news, and she was consuming only vegan diet for the past 20 years, I think, and she died of starvation. And she was pretty young. I think she was only in her 40s, and she died because her body was not able to perform its normal functions. Because it's not, we have to understand that all the fruits and the veggies that we are eating, they are micronutrients, and they are called micro for a reason, because they cannot sustain all the activities of the body. We need a little amount of macro as well. So it's called macro for a reason and micro for a reason, so that needs to be there. Also, like we've covered what all foods we need to consume, but from the point of view of Ayurveda, we also need to keep in mind that it is not just what you are eating. Along with that, there are five more things, like when to eat, how much to eat, what to do before food, what to do after food. These all can again help in better digestion of the food that you're eating. Because if the food that you're eating is not getting digested properly, then it can further cause problems. So whichever dosha is in increase in the body, it will aggravate that dosha. So we don't want a state of indigestion in the body. So to maintain that, apart from what we should eat and what we should avoid, we should also learn and imbibe these things into our daily routine so that our food gets digested properly. And only once it gets digested and assimilated properly will the nutrition of the entire body be proper, and the further activities of those joints and all the muscles will be proper. That is it.
Thank you. And the general principles which you have outlined perhaps would apply not only to those who have osteoarthritis, but also to the general population. The only thing is they may be a little more important for a person having osteoarthritis. And therefore, this also means that the family doesn't have to feel that they have to make something special for this person because this person has osteoarthritis. What is good for this person is good for the family as a whole. Isn't it?
Correct. Yes.
Let's now switch from food to another thing, and that is massage. What is the place of massage in osteoarthritis?
See, massage, sir, sometimes people think that if it is osteoarthritic condition and diagnosed as osteoarthritis, means a person has gone ahead with X-ray, a person has gone ahead with MRIs, and it is pretty well diagnosed that the person is suffering from osteoarthritis. People usually think that massage is very good, but sometimes in osteoarthritis, massage is contraindicated. It's not indicated. Reason, as I said, osteoarthritic conditions may have pain, may have swelling, may have inflammation, the redness also, and the burning sensation also. So we have to first see whether the massage is, the person is into the category of indication or contraindication. So if the person is having swelling, then massage should not be done. It's contraindicated. And which massage? The oil massage. But which massage can be done? It is a powder massage. So in that powder, we just take a powder Or we can also take, supposing if you don't have powder, if you have sand, so we just heat sand and make a bolus, jisko potli bolte, and make a bolus, heat that hot bolus in your hand. And if supposing this is the joint, then just apply on it. Just apply on it on every side. And that works for the condition where there is swelling in osteoarthritic conditions. Where there is lot of pain, then only oil application can do, or the other process which is done is dhara procedure or the basti procedure. So we do Janu Basti. The oiling has to be done, but it is Janu Basti. Janu Basti means if this is the joint, I make a barrier. I make a dough like urad ka atta. I make a circle. I'll apply that on the surface of the joint and fill that with oil. That is filled with oil. So that oil is hot, as much hot as a person can bear. And then once it becomes a bit cooler, we take out the oil, we again put oil. So 30 minutes that procedure is there, followed by hot towel steam, a wrap, towel wrap, the hot towel wrap over there. This works very good in osteoarthritic conditions. So if there is only pain but no swelling, then we can go ahead with this. But if there is burning sensation also, then we don't go with the towel wrap. So if it is only pain, then we can do the Janu Basti if it is knee joint, or we can do the Janu Dhara. So if it is the joint, then there is oil application from 4 fingers above the joint, 4 fingers below the joint. Continuous pouring of oil on that affected joint above and below. Again a 30 minutes procedure. Once it is over, then a towel wrap. So these procedures, either the Dhara therapy or the Basti therapy, and with or without the towel wrap, that works very good for osteoarthritic conditions, whether it is knee joint, or it is lumbosacral spine, or it is cervical spine, or it is shoulders. If it is shoulder, we do a Skand Basti. We can do it over here. Or they are hands, any joint. Accordingly, the procedure is done. But yes, if it is mild, then we can go for massages. And for the disease not to happen, massage is highly recommended. So this is how. And on the joints, usually it is a circular motion where we do the massage. And otherwise, Ayurveda always says, go ahead for a regular massage, whether you are suffering from a disease or not suffering from a disease. What happens is when we do these oiling procedures, specifically in osteoarthritic conditions, because of pain, the person is not using that joint. There is restricted movement. Once we apply oil, whether Basti or Dhara, the circulation starts improving. And sometimes if we do only the affected joint, then first session, second session, third session, the pain increases. Because the circulation has started, the pain will increase. Therefore, when we do this for 7, 10 or 2 weeks program. Because sometimes when third or fourth session, the pain increases, person thinks, I have done Ayurveda, but the pain has increased. So it is a natural phenomenon. Because the circulation is improving, the muscles are being relaxed, the system is toning up. So initially, it will start paining. Then after third, fourth session, the person gets improvement. So this massage has, or this oiling has that effect. So this is how we go ahead with the massage or the oiling therapies in osteoarthritic conditions.
So if I were to summarize, massage is good for prevention, which means a healthy person, if he does it, it might prevent or at least delay osteoarthritis. But once the person has osteoarthritis, then a lot will depend upon the type of symptoms the person has, whether it is just pain or pain with inflammation. And there are specialized procedures for each situation. And inflammation, the person would know from the signs of inflammation, apart from the pain, that is redness and warmth. So if that is there, then massage is not to be done, in fact. So that's
and
important.
Even at home, even at home, if there is swelling, pain with swelling in the joint, then we have this ajwain. the Indian spice. We have ajwain at home, so if you don't have anything and the smelling is there, just take that ajwain and directly heat it in a pan and make a bolus and do the dry potency. That also helps a lot.
Actually, prevention is always much better than cure. And
Correct.
maybe I'll turn
Yes.
to Mukta. Once she had told me a beautiful verse in, in Sanskrit, which I've forgotten, in praise of Abhyangam, that is a daily practice of massage while having a bath. Would you like to come in with that and add anything
Yes,
more you
sir.
like?
So, sir is referring to a shloka from Ashtang Hridayam Sutrasthan, second chapter. And the shloka goes like, Abhyangam achared nityam, sa jara shramavataha, drishti prasada pushtyayuhu, swapna sutvaktva dardhyakrit. So it basically means that Abhyang is something that needs to be done every day. So what happens is we usually wait till a disease to come and then start these procedures. But Ayurveda advises to do Abhyangam on a daily basis because Vata is something that always needs to be kept under control. It is mobile, it can move around, it can be very naughty. So it always needs to be kept under control. So to control that, because Vata is dominant in your skin, the tissue in the body that has Vata maximum is skin, because we correlate Vata to the nervous system of the body in general, nervous system and the endocrine system of the body. So the free nerve endings are all on your skin. So if you do massage daily, it is a very good practice to keep your Vata under control. So it needs to be done daily. And what are the benefits that we get from it? Jara. So the first benefit and the most important benefit is it delays aging. And by delaying aging, that means any disease that is occurring because of a degeneration, any degenerative disorder can be prevented by just doing Abhyangam every day. So Shrama, if you are tired, your tiredness will be relieved by doing massage. Then it helps in controlling Vata. It also improves your vision because it's improving overall circulation of the body. So it's going to improve your vision and it's going to give very good texture, very good luster to your skin, and it's going to provide you strength. So these are all, because when Vata is under control, then all your tissues will have strength. Like I said, Vata, when it increases, it has an opposite effect on the body tissues. So the body tissues will start to fall weak if Vata is more. So if Vata is under balance, you will be active and all your body tissues will be strengthened and your aging will be delayed. So any degenerative disorder will be prevented, and that is the case in osteoarthritis also. Also, like people who are above the age of 70, let's say, who cannot do a lot of physical workout, Abhyangam is also a very good way of passive workout because it is someone is massaging you and it is improving the entire circulation of the body. So it's a very good passive exercise and which helps in improving the overall health of the body along with your joints and other muscles.
Anything else that you would like to add when a person has osteoarthritis? Or the oils that one may use for Abhyangam, the everyday massage? Should that vary with the season or the same oil will do throughout the year?
The oils which a person can use is also depends upon the area where a person is staying. Like when you are in South India, coconut is good, sesame is good, or sesame is good for everywhere. Everybody can use the sesame oil. If supposing that is not there, even the mustard oil is very good. You can just use plain mustard oil. That's also good. So these are home oils which are used at home. So usually people have these oils at home. So either mustard or sesame or coconut. And then comes the medicated oils, which the Ayurveda medicated oils, according to what is required, we give the prescription that you can use this oil. So commonly used oil which can be used for all is Dhanvantram oil and Kshir Bala oil. So these two oils can be used for all, and rest depends upon the condition where this, which is suitable to what person, then accordingly we prescribe.
Osteoarthritis interacts in an important way with the overweight, both as the cause and the effect. A person who is overweight is more likely to get osteoarthritis. On the other hand, if the person gets osteoarthritis, there's a tendency to restrict movement and exercise, and therefore the person starts putting on weight. So you can maybe touch on this very uh, general topic of wide interest, how to reduce weight or how to keep weight under check.
Definitely, sir, osteoarthritis has a lot to do with weight. Specifically, when we talk about people having osteoarthritis of knees or ankles or lower back, because these are the weight-bearing joints. So the whole weight is on this, and the degeneration of this is definitely going to be speedy if the person is overweight. So yes, whether the person is suffering from osteoarthritis, then there are chances for weight gain. And if a person is obese, then there are chances of osteoarthritis. So definitely weight loss is very, very important. Maintaining the weight is very, very important. The simple formula is people usually, like I have a patient right now also, just please tell me what should I eat. Only food is not going to take care of weight loss. So it has to be like we have a common formula in Ayurveda, which is rule of 4 for 4. We need to take care of our food habits, our daily schedule, our behavior, and our thoughts. All the 4. So in food habits specifically, nowadays it has become very common that a person keeps on binging again and again. Because this is the knowledge which is prevailing. Thoda thoda bar bar. So थोड़ा थोड़ा बार बार के चक्कर में जो 2 बार भोजन करना है, so what happens is every person is eating after every 2 hours, and ultimately the food is not getting digested properly. So undigested food particle is entering into circulation, so that one will never end up into weight loss. So उसमें simple formula आयुर्वेद का, एक काल भोजी is equal to yogi, द्विकाल भोजी is equal to bhogi, त्रिकाल भोजी is equal to rogi. So first formula in food is 2 meals a day. This people can understand easily because all the Ayurvedic concepts, when they come forth in the form of today's fashion, people understand more, because nowadays a word has come, intermittent fasting. Now when we talk about Dvikal Bhoji, it is actually intermittent fasting. Because have dinner by 7 o'clock, don't have dinner after maximum by 8, and the next day there is no breakfast, directly the meal is in between 10 to 12. So that is intermittent fasting. So people understand intermittent fasting, but it is a concept of 5,000 years ago. जब द्विकाल भोजी बोल रहे तो समझ नहीं आती, intermittent fasting कह रहे हो तो समझ आ जाता. So this is what a simple formula for weight loss is. Have 2 meals a day, gap of 8 hours in between 2 meals in the daytime, and in the evening when you're having maximum by 8 o'clock, then the next day don't eat till 10 o'clock. If you have to eat anything, that is you drink something. So drinking is okay, whether water or herbal tea, or if you are more hungry, then it is a fruit. And then it also depends upon your Agni. If your Agni is very Tikshna, so then we are not supposed to control hunger. Controlling hunger is also the not right concept. This is also very common in weight loss people. They come to us and they say, I feel hungry, but I eat just a biscuit. So that is that you are playing with your Agni actually. Or some people, right now again I have a patient. सुबह उठ के सारे काम करके मैं 1 बजे खाना खाती हूँ. उठते कितने बजे हो? 5 बजे. So 5 बजे उठ के till 1 o'clock the person is not eating anything. Then from 1 o'clock till 8 o'clock a person is eating 3 times. So weight gain ही होना, फिर क्या होना? So that is what it is. Sometimes in between 8 hours we eat thrice, and then rest 20 hours or 16 hours we are eating nothing. So this food habit is very, very important. Workout, definitely, Vyayam is very important in Ayurveda. You do say you need to work out. So these things are daily schedule, our food, our behavior. If we are always under stress, then again that becomes very difficult for weight loss. And if our mind is always occupied in thoughts, that also becomes difficult in weight loss. So we have to take care of all the four, and of course, after that, the Panchkarma. So if we focus upon all this, then weight loss is very easy. And once weight loss is there, then the pain in joints also, a person is relieved of. That's it.
Yeah, I think in
You want to
addition
say
to that,
anything?
there is, yeah, sorry, sir. There is one more thing I would like to add. Sleep is also a very important factor when it comes to obesity. So, mostly people who wake up after 6 a.m. So, we started the talk with, we talked about Vata, Pitta, Kapha, which are the three doshas. So, the time after 6 a.m. is the time of Kapha. 6 a.m. to 10 a.m. is the time of Kapha. And the time between 6 p.m. to 10 p.m. is again the time of Kapha. So understanding, see, Ayurveda says that yatha brahmande tatha pinde tatha brahmande. Means whatever is there in this microcosm is there in the macrocosm, and whatever is there in the macro is there in the micro. So we have to, our daily routine has to be in sync with the environment. There has to be, we have to follow the circadian rhythm for the normal functioning of this body. So if we want to lose weight, it is critical, it is essential that we sleep by 10 p.m. and we wake up before 6 a.m. Because if we are waking up after 6 a.m., we are getting up in the time of kapha, and kapha is naturally heavy in nature. So you will tend to put on weight, you will tend to feel heavier, you will tend to feel lazy. So even that motivation to do workout will go away, which you want to do workout to lose that extra weight, but that motivation will go away because you're waking up in the time of kapha. So setting a sleep routine is very important. Going to bed by 10 and waking up by 6. Also, when we are looking at obesity, हमें लगता है that if we are eating heavier foods, or if we are eating a lot of food, if we are eating oily things, then we'll put on weight. But you understand that maybe your abdomen can also be like a balloon. You can also fill it up with air. Okay. So even waking up at night, because Ratri Jagran increases Vata. So if you're going to blow air into this body, then also it can get inflated. So it is not just that you have to focus on the quality of the food. Along with that, there are multiple things, because obesity is a complex disorder. Both Vata and Kapha, which are opposite in nature, are involved in this disease. Therefore, managing it again is tricky. But if you understand the very basics of how it works, it is not so difficult to manage.
It's not just food and exercise, it's dincharya as a whole, which
Yes.
matters
Yeah.
for body weight. Now, finally, I mean, Ayurveda has looks at everything from every possible angle, including that of the soul. But let's turn to something more physical, which everybody expects from any doctor, and that is drugs. So Ayurveda also, I'm sure, has some drugs which can be used in osteoarthritis. And sometimes there's a tendency to buy these drugs straight without getting a prescription from the doctor. And sometimes it goes like this, that my friend has osteoarthritis. She is taking this particular drug for this particular Ayurvedic drug for osteoarthritis. So let me also start on that. Now, this is based on the uh, usual impression that Ayurvedic drugs have no side effects, and therefore, at least it can't do any harm. Would you like to sort of say something about this type of self medication?
Ayurveda doesn't promote self-medication. It should not be there. And this statement, Ayurveda drugs have no side effects, this also is baseless, because medicine should be prescribed according to disease and the number of parameters which are taken into consideration before the prescription of a medicine. So medicine should always be prescribed by a doctor. Self-medication is not recommended, firstly. And as I said that there are no side effects of Ayurvedic medicines, this statement is also not right. It's not a right statement. When there can be side effects of food, why can't there be side effects of medicine? So Ayurveda clearly says, Aushad Dravya, Ahar Dravya. So Ahar Dravya is food, Aushad Dravya is all medicines, which are supposed to be prescribed if required. And we always say whatever, because people, they don't understand the concept of lifestyle. Any disease you have, any disease, 25% is the role of medicines and 75% is the role of lifestyle. And people usually do the opposite. Because lifestyle is where you have to enter into action, you have to participate to become healthy. So that participation a person avoids. Medicine is just take, and then the potency gradually increases of medicines. So yes, self-medication should not be there, because if one medicine suits one person, it's not essential that the same medicine will suit the other. Because the cause of a disease can be different, the constitution of a person can be different. So therefore, it should not be so.
I think you made a very important point that only drugs can do in general, only 25% of the job, 75% is to be done by the lifestyle. Now, this is sometimes seen by the person as a sort of a burden because
Yes.
modifying the lifestyle is difficult. But I think
Yes.
there's a positive way of looking at it, and that is that's an empowering sort of an idea. It
Yes.
empowers the patient to take care of his or her own health in her own hands and look after it well, both in health and disease. And even when there is a disease, 75% of the job can be done by the person himself. So
Yeah.
it can be looked upon as empowerment rather than as a burden to be carried.
Yes.
And one is, if one does it keeping in view the philosophy of yoga or spiritual philosophy, then moving from an unhealthy lifestyle to a healthy lifestyle is not a burden. In fact, it can be a source of joy. The healthy lifestyle can be much more enjoyable than the unhealthy lifestyle to which the person has got accustomed, especially if the person keeps in mind that good health is not just something to keep away pain and suffering, but good health means that now I become a more fit instrument for doing in this world what I'm expected to do to fulfill the divine will. So, if one connects it in that way, then one feels that, well, I'm making myself more fit for what the genuine purpose of life is, and therefore the healthy lifestyle becomes a source of joy. Uh,
It's very true, sir. It's very true. And I see that the people who understand this concept, they become more healthier, they become more happier, and their needs become very less. And they become light from all parts of life. And it is a truth. But it has to click here. To whom it clicks, then their life becomes very happier and healthier. And yes, we always talk about, like we now, right now, had women reservations, women empowerment. So the wording which you told right now, we are talking about so many empowerments. Why don't we empower ourselves? So that is the beauty, and that I think we should do. So we understand that's the beauty. That's very nice.
Mukta, would you like to add anything?
Yes, a shloka is coming to my mind. So there's a beautiful quote that says, "Yoga dapi visham tikshnam, uttamam bheshajam bhaved, bheshajam chapi duryuktam, tikshnam sampadyate visham." So it emphasizes on the fact that even if a poison is used in the right quantities, it can act as a very potent medicine. But even a very potent medicine, if it is not used properly, can act as a very strong poison. So to substantiate what question you asked, that taking medicine without prescription, without knowing how that medicine interacts in your body, how it works, what are the ingredients, it is not advised to take medicine just like that. Because see, what the modern approach of medicine, I'm not talking about the modern system of medicine, but the modern approach of medicine has become disease centric. We are just focused on the disease. You have osteoarthritis, I have osteoarthritis, we get the same medicine. You have fever, I have fever, we get the same medicine. But irrespective of what system of medicine you are following, whether it's a modern medicine, it is homeopathy, it is Ayurveda, whatever, the approach, if it is Ayurvedic, by Ayurvedic approach, I mean you are looking into multiple factors, dosha, dushya, desh, kal, and you are not just bothered about the disease. But where is the disease happening? The disease is happening to the rogi, to the patient. So along with the disease, the rogi is also very important. So understanding the rogi, the same disease in two people can be treated in different ways. It is not necessary that it will have the same line of management. So understanding the rogi is also very important. And therefore, the approach of the treatment has to be Ayurvedic, not just the medicines. Taking Ayurvedic medicines does not mean that you are following an Ayurvedic management. So this is for the all Ayurvedic doctors also, that the approach has to be Ayurvedic, not just the medicines. Yes.
Yes, I mean, the Ayurvedic approach takes individualization of treatment depending not only on the disease, but more than the disease, on who has the disease, takes it to its logical conclusions. And that's very important. And therefore, just taking the same drug because somebody else has the same disease doesn't make sense. So, Dr. Surinder Katoch, anything else, any other important message you would like to give to people for preventing or treating osteoarthritis?
The prevention is basically this only, that follow the rule of 4-4-4. We need to take care of physical health, mental health, social health, spiritual health. And for this, we need to take care on a daily basis on our food, on our daily behavior, on our daily schedule, and our daily thoughts. Regular massage, self-massage. Sometimes it is difficult to go to a professional masseur for a massage. So it is very important that do put oil on your head, put oil on your feet, and do a head and a foot massage where has maximum centers of different parts of the body. So regular head and foot massage, regular oiling of the body. When you go for a shower, keep oil in the bathroom. Apply oil on whole body, apply oil on all joints. And if we do like this and remain satisfied with whatever we have in life, I think that is the best way to prevent as well as manage the diseases.
Mukta, you have the last word.
I think the last word's already been given. But yes, I think
No, the
we
young
have
people should have
discussed.
that opportunity. You are the future.
No, I think we've already discussed most of the common points that osteoarthritis needs, and we should seek professional help whenever it is needed. Don't try to just do it on your own and ho jayega, hum kuch laga lenge. Don't do it like that, and don't be misled by what you are seeing or hearing on any social media. Reach out to a professional, try to understand the causative factor. See, management of any disease is very easy. I tell this to a lot of Ayurveda students also, that if I give a medicine book to a 5-year-old kid and tell him to just by heart that what medicine needs to be given for what disease, even that kid will do it. But proper diagnosis is what is important. So when we are talking from the point of view of Ayurveda, understanding which dosha is involved, even if it is osteoarthritis, vata, pitta, kapha, which one is dominant at that stage? What treatment do you need at that stage? That only a professional can understand. So please go seek help and take proper treatment. Don't do tits and bits, because that's not a long lasting kind of management.
Yes, you see, that's what we get from young people. You are so conscious of social media uh, because they have started dominating our life, and sometimes we get educated by the WhatsApp university.
Yes.
So,
Yes.
I'm just reminded of another young person who was speaking about this recently, and she said something very wise. What she said was that, yes, social media have not only become very common, they've also become a necessity. But then she said, so is food. Food is also a necessity. Food is a necessity, but the diet plan is our own hands. So, in the same way, social media may be a necessity, but what we do with social media and how much, when, what, that is still in our own hands, like diet planning.
Correct. True.
Anything else any one of you wants to say?
Right. Right. That's it.
Okay,
That
then
is it.
thank you very much for giving all these valuable tips to all those who will continue to watch this video for years to come. Thank you.